When most people think about dementia, the first thing that comes to mind is memory loss. Forgetting names, misplacing things, repeating the same question. And while memory problems do eventually become part of the picture, here is what the majority of people, and even many healthcare providers, don't fully appreciate. Memory is often not the first thing to change. In many cases, the brain begins showing signs of dysfunction months or even years before memory becomes noticeably affected, and those early signs are almost universally overlooked because they don't fit the image most people carry of what dementia looks like. By the time memory problems become obvious enough to prompt concern, the underlying process has often been progressing quietly for a long time. What we are going to cover today are 5 specific early signs that researchers and neurologists track closely, signs that show up before significant memory loss, and signs that most people, including family members who see someone every day, completely miss. Stay until the very end, because the 5th sign is the one that surprises almost everyone who hears it, and it may be the most telling early indicator of all. Before we get into the 5 signs, it is worth understanding a little bit about how dementia actually begins at the brain level, because this context makes the early signs much easier to understand and recognize. Dementia is not a single disease. It is an umbrella term for a group of conditions that cause progressive decline in cognitive function severe enough to interfere with daily life. Alzheimer's disease is the most common form, accounting for the majority of cases, but vascular dementia, Lewy body dementia, frontotemporal dementia, and others each have their own patterns of progression and their own characteristic early signs. What most forms of dementia share is this: the damage begins in specific brain regions before spreading more widely, and the earliest symptoms are determined by which regions are affected first. In Alzheimer's disease, certain memory consolidating regions are often affected early, but so are regions involved in attention, planning, judgment, and sensory processing. In frontotemporal dementia, the regions that control personality, social behavior, and language are often the first to show changes, while memory remains relatively intact for a long time. Understanding that different brain regions produce different functions helps explain why the earliest signs of dementia are so varied and so often missed when people are only watching for memory problems. The first early sign is changes in sense of smell. This one surprises almost everyone, and yet it is one of the most consistently documented early markers of neurological change in Alzheimer's disease and other dementias. The olfactory system, meaning the network of nerves and brain structures responsible for smell, is one of the earliest regions to show pathological changes in Alzheimer's disease. Studies have found that a reduced ability to identify or detect smells can precede the onset of cognitive symptoms by years, sometimes a decade or more. This isn't simply about not being able to smell a strong odor. It's about a subtle but progressive decline in the ability to distinguish between different smells, to identify what something smells like, or to detect faint odors. Someone might stop noticing when food is burning before they can see the smoke, or might find that food doesn't have the same richness of flavor it once did, since flavor is largely determined by smell. They might not notice strong odors that others in the same room immediately detect. Because smell loss has so many other potential causes, including nasal congestion, sinus problems, and normal aging to a limited degree, this sign is almost never connected to brain health in everyday life. But when smell loss is progressive, unexplained by obvious nasal causes, and accompanied by any of the other signs we will discuss, it becomes a meaningful piece of a larger picture that a neurologist would find significant. The second early sign is a change in sleep patterns, specifically the development of a condition called REM sleep behavior disorder. During normal REM sleep, the stage of sleep associated with vivid dreaming, the body is in a state of temporary paralysis that prevents people from physically acting out their dreams. In REM sleep behavior disorder, this paralysis mechanism fails, and people begin physically acting out their dream content, sometimes talking, shouting, thrashing, kicking, or getting out of bed while still in a dream state. This condition is strongly associated with the same type of neurological changes that precede certain forms of dementia, particularly Lewy body dementia and Parkinson's disease dementia. Research has found that a large proportion of people diagnosed with REM sleep behavior disorder go on to develop one of these neurodegenerative conditions within years to decades. Because this sleep behavior often happens without the person's awareness, it is typically a bed partner or family member who first notices that something unusual is happening during sleep. If someone you live with has begun talking or moving dramatically during sleep in a way that seems connected to dream content, this is a symptom worth discussing with a neurologist rather than dismissing as simply a quirky sleep behavior. The third early sign is subtle changes in personality and social behavior that feel like a personality shift rather than a memory problem. This is particularly characteristic of frontotemporal dementia, but it can also appear in Alzheimer's disease as a relatively early feature. The changes are often gradual enough that family members struggle to pinpoint exactly when they started, and they can be mistaken for depression, stress, anxiety, or simply a change in attitude. What neurologists look for is a pattern of behaviors that are genuinely out of character for the individual, changes that the person themselves may not recognize or acknowledge. This might include a previously warm and socially engaged person becoming flat, withdrawn, and uninterested in people they previously cared about. It might include a previously tactful and considerate person making blunt, inappropriate, or socially embarrassing comments without apparent awareness of how they land. It might include a decrease in empathy, where someone who was always emotionally attuned to others seems to stop registering or responding to the emotions of people around them. It might include unusual impulsivity, spending money irresponsibly, making uncharacteristic decisions, or abandoning long-held interests and values. Because these changes affect personality rather than memory, they are often attributed to psychological causes, relationship dynamics, or life circumstances rather than to brain pathology, and they can go unexplained and unaddressed for years before the broader picture becomes clear. The fourth early sign is difficulty with spatial awareness, navigation, and visual processing. People in the early stages of dementia sometimes begin struggling with tasks that require visual and spatial processing in ways that are easy to attribute to other causes. They might have increasing difficulty with driving, particularly in situations that require judging distances, navigating complex routes, or responding quickly to changing traffic. They might get confused about their surroundings in familiar places, missing a familiar turn they have taken hundreds of times, or becoming briefly disoriented in a familiar building. They might have difficulty reading because words seem to move on the page or the visual field feels less stable than it used to. They might struggle with tasks that require visual spatial organization, like packing a suitcase, arranging items on a shelf, or following a map. These difficulties arise because the regions of the brain involved in processing visual and spatial information are affected early in certain forms of dementia, and because they so easily get attributed to eyesight problems, tiredness, or simply not paying attention, they rarely prompt the kind of concern that would lead someone to a neurological evaluation. If someone who previously had confident, reliable spatial abilities begins showing consistent difficulties in this area, particularly when other explanations have been ruled out, this is worth noting as part of a pattern rather than dismissing as a one-off mistake. The fifth early sign, the one that surprises almost everyone, is changes in language that don't look like memory problems at all but reflect the same underlying process. Most people think of language problems in dementia as forgetting words, which does happen. But the earliest language changes in dementia are more subtle and more varied than simply forgetting a word. A person might begin struggling to follow complex conversations, losing the thread when multiple people are talking or when sentences have complicated structures. They might begin using vaguer, more generic language, substituting thing or stuff for specific words they previously used precisely and confidently. They might begin having trouble with reading comprehension in ways that are hard to distinguish from simply losing interest in reading. They might find that writing, which was previously easy and natural, now requires effort and produces output that lacks the complexity or clarity it once had. They might have difficulty following the plot of a book or television program, not because they forgot what happened but because the narrative processing that tracks and integrates story elements is becoming less efficient. These language changes often get noticed by the person themselves as a vague sense that their thinking feels less sharp or less fluid than it used to, but they are rarely identified as potential neurological signs, and they almost never prompt medical evaluation on their own. Now let's talk about why these 5 signs are so consistently missed, because understanding this is essential to understanding what needs to change. The most fundamental reason is that dementia awareness in the general public is almost entirely focused on memory, which means that when the earliest signs show up in smell, sleep, personality, spatial processing, and language, there is no mental framework available to connect them to brain health. People are not watching for these changes, and even when they notice them, they have no reason to connect them to the possibility of neurological disease. This gap in awareness is not just a matter of education. It has real clinical consequences, because the window between these early signs and the development of more obvious cognitive decline is precisely the period when intervention, lifestyle modification, and in some cases emerging treatments have the greatest potential to make a difference. Another reason these signs are missed is that they develop gradually and inconsistently. Unlike a broken arm or a fever, which are clearly abnormal from the moment they appear, early dementia signs often emerge as a subtle increase in the frequency of things that happen occasionally to everyone. Everyone occasionally can't identify a smell. Everyone occasionally has a vivid dream that seems unusually real. Everyone occasionally struggles to find the right word. The pathological version of these experiences differs in its pattern, its progression, and its context rather than in a single dramatic episode, which makes it inherently more difficult to recognize without a framework for what to look for. Family members and close friends are often the first to notice something has changed, and the response that most often serves the person best is the one that is hardest to have, which is a direct, caring, and non-alarming conversation that names the changes specifically rather than either pretending nothing is happening or catastrophizing about what it might mean. It is also worth discussing how these 5 signs relate to each other and why they sometimes appear together in ways that start to form a recognizable pattern over time. The brain is an interconnected system, and the pathological changes that drive dementia rarely stay confined to one region for long. What often happens in practice is that a family notices one thing, perhaps an unusual sleep behavior, and dismisses it as unrelated to anything significant. Then they notice a personality change and attribute it to stress or aging. Then they notice the person struggling with directions and assume it is just a bad day. Then they notice the language becoming vaguer and assume the person is simply tired. Each observation in isolation seems explainable and manageable. But when a neurologist or a thorough general practitioner hears the whole list, the pattern that emerges across sleep, personality, spatial function, smell, and language can be highly informative in a way that no single observation would be on its own. This is why keeping informal notes about changes you notice in yourself or someone you care about, even just brief diary entries, can be genuinely valuable. It transforms a collection of dismissed individual observations into a documented pattern that gives a clinician something meaningful to work with. The question of when to seek evaluation is one that many families struggle with, often erring on the side of waiting longer than is ideal. The most useful guideline is simpler than most people expect. If you have noticed a change from a person's previous baseline that has persisted for more than a few weeks, that is not explained by an obvious cause like a major illness or significant life stress, and that fits any of the categories we have discussed today, that is reason enough to bring it to a doctor's attention. You do not need to wait until the changes are dramatic, undeniable, or causing obvious functional impairment. In fact, waiting for that level of severity is precisely what delays evaluation to the point where the most meaningful window of early intervention has already narrowed. A doctor who hears about subtle early changes and finds nothing concerning on evaluation has lost nothing. A doctor who hears about subtle early changes and finds something that needs attention has potentially gained months or years of earlier intervention. The lifestyle factors that research increasingly associates with reduced dementia risk are also worth mentioning, because they are most relevant precisely during the period we have been discussing, when subtle early changes may or may not reflect an underlying pathological process. Regular aerobic physical activity is one of the most consistently supported lifestyle factors for brain health, with research finding associations between higher levels of physical activity across life and lower rates of dementia. Cardiovascular health more broadly, including managing blood pressure, blood sugar, and cholesterol, is directly relevant to vascular contributions to cognitive decline. Sleep quality matters significantly because it is during deep sleep that the brain clears metabolic waste through a system that may be relevant to the accumulation of proteins associated with Alzheimer's disease. Social engagement, cognitive stimulation, and management of depression and chronic stress all appear in research as factors associated with better brain health trajectories. None of these guarantees protection against dementia, but for someone who has noticed any of the 5 early signs we discussed today, adopting or reinforcing these habits is a meaningful and evidence-informed response that addresses the modifiable factors within their control. Saying specifically what has been observed when it was observed and why it seems different from before gives a doctor the kind of detailed behavioral information that is most useful for assessment. Bringing notes to a medical appointment, even a simple written list of what has been noticed and when it started, can make a significant difference in how thoroughly these concerns are evaluated. Let's also spend a moment on what medical evaluation for potential early dementia actually involves, because many people delay seeking evaluation partly because they are uncertain about or anxious about the process. A thorough cognitive evaluation by a neurologist or a neuropsychologist typically includes a detailed history, structured cognitive testing that assesses multiple domains of function rather than just memory, a review of medications that could be contributing to cognitive symptoms, blood work to rule out reversible causes of cognitive change, and in many cases brain imaging. This process is not as frightening as many people imagine, and one of the most important things to understand is that many conditions that look like early dementia have reversible or treatable causes, including thyroid problems, vitamin deficiencies, medication side effects, depression, sleep disorders, and metabolic issues. Getting a thorough evaluation is therefore not a step toward a diagnosis of inevitability. It is a step toward understanding what is actually happening and what, if anything, can be done about it. Before we close, it is essential to say clearly that this video is for general educational awareness only. None of the signs described here are diagnostic on their own, and the presence of any of them does not mean that someone has dementia. The appropriate response to concerns about cognitive health is always a conversation with a qualified healthcare provider, not a conclusion drawn from a video. What this video can do is expand the awareness of what early neurological change can look like beyond memory loss, so that the right conversations happen sooner rather than later. If this video helped you see something in a new way, or gave you the words to describe something you have been noticing in yourself or someone you care about, please share it with someone who needs to hear it, because this kind of awareness is exactly what most families only find after the window of earliest opportunity has already passed. If you found this video helpful, please like it and subscribe to Dr. William Hart Health for more videos like this every day.